I mean, Peyronie's disease really is kind of a clinical diagnosis. So number one is some sort of penile deformity, and generally we kind of associate that with curvature because that's typically the main thing that can affect your ability to have sexual intercourse. But there are kind of other things that kind of are play into the definition of Peyronie's disease and acquired curvature. That includes things like an indentation when you have an erection, or kind of what they describe as an hourglass deformity, where there's kind of a circumferential narrowing in an area. Or lastly, you can also have kind of like a hinge effect, where with a full erection, there's an area on the penis that tends to buckle with certain positions. And that certainly can be a cause of concern for a lot of guys if they're worried about having an injury during sexual activity. So there's certainly kind of a lot of things that play into Peyronie's disease, although a lot of the focus really is on curvature.
And do we know what is actually causing that curvature in Peyronie's? Like what makes the penis bend that way?
Yeah, so I mean, most men have a plaque that develops in the tunica, which is kind of the tissue that surrounds the erectile body. And this plaque or tissue basically prevents the symmetric expansion of the erectile body when someone has an erection. And generally, we don't really know the cause of what leads to this plaque and subsequently leads to Peyronie's disease. There's kind of a lot of research in this area, but the thought is that there's kind of this abnormal healing process that occurs, and ultimately there's kind of deposition of collagen and basically just scar tissue that occurs at this location where the plaque is. We do know that there are certain things that are associated with Peyronie's disease as well. The idea of developing penile microtrauma with sexual activity, where there's kind of a repetitive injury to kind of the same area, and over time that can lead to scarring. I would say that we usually ask about that in terms of guys that are coming to see us, in terms of do you remember a time when you had kind of an injury with sexual activity or penetrative intercourse? But it's not that common. I would say maybe 20-30% of guys remember an incident. Generally, the cause is unknown, and it kind of just comes out of the blue. Certain autoimmune conditions certainly can be associated with Peyronie's disease, such as lupus. And then lastly, there are other superficial fibrotic diseases that correlate well with Peyronie's disease. One is Dupuytren's contracture, which basically is scar tissue that can develop in the palm of the hand. And that's actually fairly comorbid. So in folks that have Dupuytren's, so the scar tissue in the palm of the hand, about 40% of those guys will have Peyronie's disease. And then in guys that have Peyronie's disease, about 20% will have Dupuytren's. So there is quite a bit of overlap with those two conditions.